Hello again, everybody, and welcome to another Inside Lowell podcast. Today, we're going to chat with State Representative Vanna Howard, representing the 17th Middlesex District, comprised of Lowell and a little smidge of Tewksbury. I didn't miss any other communities, right? Okay. So mostly Lowell, which is really what we care about. We'll give Tewksbury some of our leftovers, but we got a lot to talk about with Representative Howard. She's got a lot of legislation filed for 2024, and we'll delve into that and her priorities. First, I want to thank all of you for joining us here on this Inside Lowell podcast, and of course, want to thank our sponsors for making this podcast, all of our podcasts, and for that matter, all of Inside Lowell possible as well. Thank you to our friends at Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank. Unicare, offering a variety of plans for people insured under the GIC. At Unicare, your health is their top priority. Boston North Company, business solutions to help restaurant and retail clients save money. Make your business more profitable today with Boston North. Mahoney Oil Company, providing oil and warmth to Greater Lowell and Southern New Hampshire since 1925. That's nearly a century. That's Mahoney Oil. Francis E. Preventure Insurance. For auto, home, business, and life, trust the agency Greater Lowell has counted on for more than 40 plus years. Francis E. Preventure Insurance. GoPuff, a grocery store right at your fingertips and fingerprints. Use the code Lowell20, receive $20 off your first order of $21 or more. Get free delivery with that special promo as well. Download the GoPuff app or visit gopuff.com. And by the Massachusetts Pirates, bringing all the hard-hitting action and excitement of arena football to the Tsongas Center in downtown Lowell. Get your tickets today by visiting masspiratesfootball.com. And with that, we turn our attention to State Representative Vanna Howard joining us for the first time here on an Inside Lowell podcast. How are you?
I'm so excited to join you this morning.
Are you really?
Happy Friday.
Happy Friday. By the way, we're recording this at 9 o'clock on the Friday, which for most people, they're usually telling me, getting an early start. You probably have been outside already doing your normal Friday morning walk with Jack Moynihan and the other volunteers in downtown Lowell, right?
Not this morning because the streets, we skipped this morning because the sidewalks in downtown pretty much still frozen.
Yeah.
And so, so we skipped today.
All right.
But we might be back tomorrow.
But you got a host of other events planned for the rest of the day. Immediately leaving here, you're heading over to
the Coalition for a Better Acre for ribbon cutting.
Which specific project are they cutting the ribbon on today?
The ribbon cutting, this is housing, permanent housing for folks that's in recovery. So it's 12 units, I believe, permanent housing for folks that in the recovery. So
is this the one over on Merrimack Street?
555 Merrimack Street. Yes.
Awesome. Great.
Yes.
So when do they expect the first residents to start moving in this weekend?
Some have moved in already.
Oh, really?
Yes,
Oh, okay.
Some already have moved in. So we're excited to do a tour right after the ribbon cutting.
Awesome.
But thank you for having me here. I'm excited.
It's good to have you here. As we mentioned, we're going to talk about your priorities in 2024. Perhaps fittingly, I don't know if you did this on purpose, but if you did, brilliant stroke of creativity there. You have filed 24 bills in 24. I like it.
24 bills, not for year 24, but 23 and 24 in the 193rd session, legislative session. So yes, I filed 24 bills. And they're all good bills. And it's, as you know, my priorities for this session and just last session is really, we are pretty much in a post-pandemic, COVID-19 pandemic in every facet in our communities. And so really, for me, is to, again, continue to make sure that folks have access to medical care, to health insurance, making sure their unemployment, benefits are met. I receive right before Christmas lots of unemployment cases, and we were able to help them receive their benefits. Education, transportation, really a whole host of things that I will continue to make sure that all their needs are met. And really, for me, it's apply equity lens to all legislative activities, and attack issues from all angle. And my really number one top priority, as you know, since I've been elected and very fortunate to be elected, to really be accessible, be responsive, available all the time to constituents, to really be there for them and show up and to listen to their needs. So really, those are some of my priorities.
All right, you mentioned a couple, and I want to focus on them. I've noticed that through your tenure, and you got sworn in January of 2021, right in the midst of the whole pandemic drama. You campaigned during COVID, and then the fallout, which has lasted for a while. But I noticed health care seems to be a general theme of a lot of the bills that you filed. What areas in particular do you really want to hone in on? And if you can kind of tell us what you're trying to accomplish with some of these bills.
Sure, yes. Thank you. That's a good question. One of my bills is really for cancer detection, breast cancer, early cancer detection, especially for women, even men. Breast mammograms screenings. Right now, for your annual mammogram screenings, zero, no out-of-pocket cost. However, if you're from a family, that high risk with breast cancers, or you are at a higher risk percentage, so you go for your second screenings. That's expensive. Insurance don't pay for that. And so that might delay some of, folks in a higher risk to go for the screening. So that bill is to make sure that if they should require to go for the second screening, that there won't be any no out-of-pocket
So,
costs.
all right, so that's fascinating to me. Is it 40? Is that the age, or is it younger where you're recommended?
It's younger now, especially if you are from a higher risk, family members with a higher risk,
So healthcare will cover the first one, but not follow-up. That sounds kind of crazy, right?
It is. So for that, because it's expensive to go for the second one, they might delay from not going, and that's a shame, Yeah, when we talk about breast cancer, not just women, men too. And so we have to get our screening every year. I do it every year. It's not fun, but you want to survive. You want to be healthy.
So does health insurance? So is the recommendation? And forgive me, I don't know these rules, but so is the recommendation to go get screened every year after you do your first one?
Every year, yes.
And health insurance doesn't cover any of them, or
your annual one?
The first annual one. Okay.
The annual is covered.
But if you're high risk, you need more than one a year.
Second, yes.
But that's the recommended. Doctors, hospitals, health policy recommends that. You would think that it should be mandatory.
That's right.
For insurance companies.
But it's not.
All right. So is that the specific language? I can't imagine it's not going to fly through the process, something like that, right?
Well, as you know, I am shepherding all my bills through the system. It takes quite a bit of work to get bills passed. So my 24 bills, out of this session, we file over 7,000 bills.
Wow.
And so, a lot of getting my bill, especially this one, out of the 24, passed is just a lot of work. Talking to everyone, getting the support, really getting the necessary support to get your bills passed by having, testifying. You testify on your bill, get the support, not just from my colleagues, but from anyone that would find this bill be important to them as well. It's really getting the village really to support.
You know, you're giving me more ammunition here. You're not going to make some folks very happy. You're not going to make Jack Mitchell happy, because I'm always telling him government is broken, and the bigger it gets, the more broken it seems. But this just picking this one right here, to me, seems pretty simple, right? I know you got 24 bills, and I know there's a process that has to be followed. But there's got to be a way where people can look at something that needs to be fixed immediately. If it was an emergency, they could certainly pass legislation quickly. The governor was able to change her budget in the snap of her fingers. I don't know why something like this just doesn't get pulled out, get unanimous support, get voted on, signed by the governor, and boom, it's done. But it's stunning to me that you have to go through a lengthy process.
I mean,
are you sure it's going to, but do you think you have the votes there? Have you been talking to others there? Is there anybody opposing it besides maybe the insurance lobby?
I have not heard from anyone, opposing to it. But again, 7,000 plus bill, all good bills, right? I'm competing. And so I'm sure there's many other bills very similar to this bill as well. So, the committee will make a decision to report it out favorably or not. But there's so many bills out of the 7,000 plus that's very similar in the language too. It's just, choosing which one to report forward.
Are you hearing from the insurance industry?
No,
what's their opposition? Even they're not opposing?
I have not heard. So I'm hoping it will get passed.
All right.
In this session.
Interesting. You mentioned unemployment, people coming to you for help with unemployment claims. And I remember that was a big deal. I tried to kind of help some of my employees during COVID, when everybody was basically forcibly laid off, and before the PPP money came in, which kind of helped that out. But it was just frustrating that that was going on. That was 2020. It was all brand new. What are the challenges now? Why are the folks who are coming to you having a hard time with their unemployment claims?
The unemployment, some of the cases that came that we were able to resolve, just delays in getting their benefits. And we have a great contact at the DUA, Department of Unemployment Agency, the liaison there. They reach out to us because our constituents have not heard. It's been weeks, sometimes a month, sometime more than a month. So we were able to reach out and get the constituent in touch with the DUA.
So in 2023 and 2024, there's still that much of a backlog. I understand back in March and April of 2020, I get it. Unemployment was crazy, and some of those folks weren't working from the office.
But
it's 3 years later, there's still
Christmas. Yes.
Wow.
Yes.
And again, more ammunition.
But we were able to resolve. So yes, they were able to get their benefits before Christmas.
But seems like a systemic problem. There's got to be a way to speed up the system, and some cases maybe they're not required, but you said you were able to resolve these, and so obviously these were legitimate cases. Crazy to me.
So government does work. We
work. Or
get it done.
Yeah, when you bring the repairman in, it works, or the repairwoman.
Yes.
But okay, a couple of other things that you focused on: pre-K access and early childhood education.
Early childhood
is important to you. So we've just started running a series. Bill Haydad from On the Move, focusing on ECE, early childhood education, has been showing how well. I'm sad, but how disappointing the third grade reading level scores are on the latest MCAS test. And here in Lowell, it hits minority communities harder, poorer people harder. And here in Lowell, you've got 3 out of every 4 third graders cannot read to level. And this series, and I encourage people to go read it on InsideLowell.com. It's called Crisis in Early Childhood Education. It's showing you what that means for the rest of their education, and then what it means for the rest of their life. And just kind of to recap, if you can't read at a third grade level by the time you're third grade, you're catching up your entire time, because starting 4th grade and beyond, you need to be able to read to do math problems and science and everything else that you do in your career. And unfortunately, those people generally don't catch up. So by 8th grade, they're still way behind. And then what happens is they're behind in life. And studies are now showing these are your folks who are most likely to end up homeless, battling some type of addiction issue, incarcerated, etc. So it's a major, major issue. I've seen the difference preschool can make, and we're fortunate enough, my wife and I, we've been able to send our kids from pre-K 3 and beyond, and they're so far advanced in terms of reading from where I was at that age because I didn't start till kindergarten. What are the main goals of your bill that's addressing this? What are you trying to accomplish, and how are you trying to get access for everybody to be able to afford pre-K?
Sure. Everything you said, correct. We have kids that not reading sufficiency at grade 3, and as a result, you end up, the rest of their lives not doing well, the majority of them. So this bill that I filed to make sure that pre-K 2 years and 9 months get full day kindergarten, full day, to reduce that reading achievement gap. So by the time they get to 3rd grade, if they get full day, because right now, because childcare is expensive and there's a wait, and so, but if we can get pre-K to get to full time, full day kindergarten, that will reduce the achievement gap and help with the reading. By the time they get to 3rd grade, their reading will be sufficient, and that will help them, for the rest of their lives.
Okay, so my kids, it's a little bit foreign to me because my kids are in a private school, the Hellenic Academy, and they offer pre-K 3, actually 2.9 and above. So I was able to send my daughter in there. Do the Lowell public schools, do they have the capabilities to offer preschool programs within Lowell public schools, and for that matter, Tewksbury, which is the other town you represent?
So I think they do. There's a wait list. I think if we can come and, this is really our future generations. We can make sure that our children to be successful for the rest of their lives, if we can think to, because we keep talking about, we have so many kids that not reading at the level when they got to 3rd grade. We really need to make sure that this happens. And I'm hoping, again, getting all the necessary support to make sure that this bill is a priority, a top priority, hopefully this session as well, because we really need to really tackle that immediately. This is a matter of urgency. We can't keep talking about, our children by the time they get to 3rd grade not reading. So we really now need to look at a pre-K.
So what type of access is lacking, and what is your bill doing to address that? Is it a matter of there just aren't enough buildings, facilities? Is it
staff? If we're gonna give full time, you want to make sure, especially like Head Start, Early Start, to make sure they have enough workforce, enough. Really, that's the workforce right now. Pay our teachers better as well. We need more teachers. We don't have enough teachers right now, and the pay is not that great. So we can incentivize our teachers, the pay, but also the workforce, get people, especially at lower high, right? So letting us, if they graduate from high school, go to college and stay here and give back, because right now, early childhood and early care and early EEC, we have the highest shortage in that area right now. Okay. So we can address both, making sure that we have the enough workforce to address the gap with 2.9 year olds, and making sure that they can read sufficient by the time of 3rd. So it's two things that we really need to come together and address this.
Yeah, the staffing thing seems to be a problem everywhere. And again, I want, because this isn't something new. This has been talked about. Early access, and Head Start was created to deal with this. But boy, Head Start was created, I think, like 30 years or so ago. So
and you got pandemic to it, add to it. You have the workforce shortage is really right now, in addition to housing crisis.
Okay.
Yeah.
Let's talk about that housing crisis, because one of the areas that has been controversial is a bill that you have co-signed onto that would allow ADUs by right, and you put it in, I think it was for elderly family members. I'm confused with all the ADU bills.
Right.
So why don't you tell me what your bill specifically calls for?
Well, thank you. The one bill out of the many bills filed this session related to ADUs. By the way, the one bill that I co-sponsored for our seniors, our elders, and folks who are disabled to be able to live, with someone in a private home, rather somewhere else, in another, property may not have elevators. If you are in a wheelchair, if you have mobility issue, if there's no elevator and there's only stairs, how are you able to, even as seniors, elderly, they can't be climbing those stairs even to the second floor. So that one particular bill that I co-sponsored specifically for ADU for seniors, elders, or folks with disabilities. And it's a bipartisan bill. This one particular bill filed by Rep. Christine Barber Somerville in the House. Senator Bruce Tarr filed it in the Senate. So exactly same language. It's a bipartisan bill. I mean, can you imagine telling your disabled member of your family or your mom or your dad, no, go live somewhere else. You can't live here. I said, can you imagine telling someone that? And as you know, I have a daughter who's disabled. If I own a home and I say want to add a unit so that my daughter, my disabled daughter, can continue to live with us, however, if I'm not allowed to do that, where am I going to send my daughter to?
So,
you wouldn't kick your parents out if they want to live with you.
My sister's trying to drag my father into her house right now, but
that's one bill that I filed.
So
that I co-sponsored.
Locally, that effort really got very controversial during Lowell's battle, and Lowell's ADU battle was far more reaching than what you're trying to accomplish. In particular, your two colleagues from Lowell, Representatives Elliott from the 16th Middlesex and Mom from the 18th Middlesex, they actually wrote a letter opposing it. And it was also signed on, I believe a couple of city councilors may have signed on to that as well. Have you discussed this particular bill with them and mentioned that it's a narrow focus? Are there loopholes in your potential legislation that might open it up to more?
Exactly, just that. For the disabled, for seniors, or for elders who wants to stay with their family.
Does it say it has to be family? Is that, I haven't read the bills.
It didn't say family. It just say for seniors, elders, and folks with disabilities.
So could that be where the kind of opposition and the controversy stems in? Because I think if it's family, it's very difficult to be opposed to it. But if it's not open, if it's open to everybody else, and then disability also includes addiction issues, correct? And when we need housing for addiction issues. But generally, those tend to be in larger settings, 6, 8, 28, whatever the number is.
Right. And again, this bill said you have to follow the local ordinance. And so if you have to go before the Zoning Board of Appeals to make sure before you add any addition to your place. And you can't just start building. You have to follow the ordinance too, just because, say, if the city had voted to allow by right, but ADU has been existed here in the city of Lowell. You have to go before the Zoning Board of Appeals to ask for the approval. And so the opposition letter, I did not hear from my colleagues about it. I actually read that when you posted on InsideLowell.
You have to read InsideLowell if you want to learn these things. Thank you for the commercial.
Yeah, thank you. I did not. I was not invited to see the letter before it got submitted.
Would you be willing to amend your bill to specifically say family, which may drop that position? Oh, okay.
It's not my
so you
bill.
co-signed. Okay.
I co-sponsored the bill.
Would you have that discussion with Representative Barber about
Representative Chris? I would. Yes, anybody would. Now, 20 plus bills filed this session, as I mentioned earlier, and these 20 plus bills related to ADUs went before the Joint Committee on Housing in July, and as of I think last week, there were no opposition from anyone from the city of Lowell. No one testified in opposition to any single bill that went before the Joint Committee on Housing, not even a written testimony against, and that was in July.
Okay. The governor has now proposed a sweeping ADU bill. To your knowledge, does it include the provision that you're supporting here? You've co-sponsored with Representative Barber. Does it include the disability and family
It
provision?
mentioned, I believe it mentioned about by right. The by right.
Okay.
Right. So by right, meaning if you're a homeowner, you have the right, you don't have to pull a special permit or hire an attorney. But still, even if by right, you still have to follow the local ordinance. And I just want to say a little bit more about ADU. Just, I'm for ADUs. Doesn't mean, for example, Back Central, Lower Highland, areas in the city of Lowell that are congested. If they're going to, again, that would be up to the approval of the zoning board of appeals, whether to allow ADU, say, in the back center. If someone wants to apply to add, in addition to it, would have to make sure there's appropriate parking, right? Because back center is very congested. If you allow ADU, how many cars going to be parked there? Or Low Highland, same thing. So just because I'm for ADUs, I'm also mindful of a certain area, especially in the city of Lowell, is very congested. If you're going to add ADU, you want to make sure. I hope the zoning board of appeals, will look at to make sure there's appropriate, space for someone to park.
So the battle line to me is going to be what the governor's bill specifically allows local cities and towns to do.
Right.
I kind of get the sense that the bill you're involved with and the other 19 are probably going to stall until the governor's proposal either adopts all of them and then that gets voted on. Is that kind of the sense you're getting as well, that you're not going to get a vote on that particular bill, that you're going to have to kind of lump everything together under one giant bill?
It's 20 plus bills. So yeah, we'll see. Yeah, we'll have to wait and see.
All right. And lastly, because you have to leave in about 5 minutes to get to that ribbon cutting, I want to talk about the governor's budget.
Okay.
What are we on? 6 consecutive months now where revenue projections have not met. The revenue has not met the projections.
Shortfall, yes.
The governor has now instituted cuts to get us through June 30th, and she has warned that July 1st, the next fiscal year, it's going to be even more cuts than what she instituted to end the year. How are you guys going to deal with that without raising taxes? Because at the same time, yesterday, she confirmed that she doesn't want to institute any new taxes.
Yeah, that's good. We have way to see. I know it's, it was tough, I'm sure, because unlike the federal government, Massachusetts, we're required to balance our budget. And so because we have a shortfall of, $1 billion, and one of my earmarks. So I just want to, with this cut, it was like 5% of the budget it was slashed, about 5%. However, municipalities and schools, local aids were not touched. So that's great. Just some of it's like one of my earmarks was slashed in half. So it was not, eliminated. It was not eliminated. It was cut in half for Tewksbury that I got for $20,000 for wellness and cancer screening for our Tewksbury Fire Department from $20,000 to $10,000.
Okay, but she has received criticism for some of those cuts are really hitting some of the more needy communities.
You have
right?
Challenges ahead, and so with that cut, a lot you have agencies that will have to do a little less. They were hoping to get the full amount. Now it's slashed in half.
Do you think she can pull this off without raising some revenue, aka taxes? It's an election year not for her. She has 3 more years, but all of you in the House are going into an election. As of now, you don't have any challengers, but you never know. But tax increases are tough.
It's tough.
Things to run on, right?
Especially for our seniors, for our working families, for our low incomes folks. So we can avoid that. But again, we have to rebalance our budget here. She has to rebalance our budget. We have to rebalance our budget. And so, yes, it's going to tough days ahead for us. But I'm hoping that we'll come somewhere in the middle here to make sure that our seniors, our families, working families, middle class, stay, in place.
All right, you had to know I was going to go here, but
Yeah.
would it help the state budget if we'd stop spending $45 million a month on, call them whatever you want, migrants, immigrants, illegal immigrants, or whatever? That's a lot of money, and it seems to me that that's an easy thing for the governor to say, hey, no more. We already have a problem. We already have a waiting list, a record-setting waiting list. We've flooded the system as is. They're taking buildings out of, downtowns like the Inn and Conference Center in your district. Wouldn't it make sense for the governor to just kind of say, put a freeze on all that instead of continuing to I don't want to say roll out the welcome mat, but people are going to keep coming if they know that they're going to get priority.
Yeah. This is America, right? We're here. We can't turn our backs on people who need help. We can't turn our back. This is America. They did it for me. They did it for me. And, the migrant families, they're not illegals. They're not criminals. They're just fleeing extreme violence, extreme hardship. They're here. And we need to help them. This is what America does. This is what America did for me and for many before me. The emergency assistance shelter that the governor had declared to help American families, but also unhoused folks, women, pregnant women, women with children, families with children that are staying at the emergency assistance shelter, not just American families. I just want to make, clarify that, not just American families that stay at the emergency assistance shelter.
At the Inn and Conference Center, I'm told they're all migrants that they haven't allowed.
That's not true, actually. There are families that from around Massachusetts that some have moved here too, not just all migrants. The majority, there are some, yes, migrant families come from Haiti. However, there are unhoused folks, women, families with children, infant children. I actually just got a case the other day where not migrant families, family with infant children that's staying at the Inn and Conference Center.
But weren't those families migrants at one point or another? They came in, and I have to push back on this a little bit because you cite your case and what the genocide was horrible, and yes, the United States reached out and helped, but unless I'm wrong, you and your fellow Southeast Asians who came here, you didn't get hotels for 2, 3, 4 years. You got some money and you got some assistance, but you had to fend for yourselves in a lot of ways. There wasn't this unlimited, for instance, the families at the Inn and Conference Center are coming from hotels in Billerica and Fairhaven and other communities that were named, and I can't remember them, which means they've already been here for a year or two. Now another year or two. You didn't get that, did you? Your family didn't get that. Free healthcare.
We did. We got public assistance for about 8 or 9 months, and so yes, we did. We did receive assistance to help us assimilate to this new home, just like we're doing right now for these folks. I mean, some of these folks now have working permits. So they're going to be mass hire, low career center, are helping these folks at the Inn and Conference Center with finding employment, skill training. So that's what they're doing. So many of them now have working permits to find jobs. So they're going to be once they have job, they're gonna be wanting to, find apartments for their families. So good news that they have many of them now. I think out of the 7,500 migrant families that had came, about 3,000 now have working permits.
But 8 or 9 months of assistance that you received is a lot different than years, and we don't know how many this will keep going.
Well, the governor declared the emergency assistance, the emergency crisis last August. So we have families originally, families coming since last August. So it has not been a year, but these families now have, working papers, I know they're going to be working just like we did. Once we had working papers, we did find jobs and we became self-sufficient and raise a family.
Why is the federal government not offering this kind of assistance? The governor has called for it. The governor of New York has. The governor of Illinois has. Governors all over the country have said we need help. Why isn't the White House helping?
Yes, I am actually reach out to our Congressman Trahan, about it to ask for her help in this as well. And I did ask her as well, request that she reach out to her colleagues in Massachusetts and across the country to help with with this matter as well. So I did have a conversation with her as well, seeking her help.
Did she indicate that some help might be forthcoming?
She's working on it. She's trying. She and her colleagues are working to make sure that our families' need are met. Yeah, I mean, just imagine fleeing. All you want just for better lives. I mean, really, having lived through it, fleeing Cambodia, having lived through the genocide, I can't imagine carrying your little children, walking miles and miles.
Well, you can imagine because you've done it.
I've done it, so I can relate to the migrant families, what they had to go through, to be here, what they had to go through. So I could relate.
Okay. Representative Vanna Howard, thank you for the time. I hope to get you back in here at some point. If you're running unopposed as you did last time, we'll definitely get you back in here. If you do get a challenge, I'd love to host a debate at some point. Okay?
Absolutely. I would love to come back. Thank you.
All right. Great to have you here. Thank you so much.
Thank you.
All right. And thank all of you for joining us as well on this Inside Lowell podcast. As we like to say, Inside Lowell. If Lowell is your home, this is your place. Till next time, stay safe, everybody.